So next up, we have Representative Judy Chu. And apologize here, I'm looking at my notes. She will give a report about the newly formed Congressional Medicare-for-All Caucus and the effort to win Medicare-for-All in U.S. Congress. And I'm sure you guys all know about her. I'll just share a little bit more about her. She's the chair of the Congressional Asian Pacific American Caucus. She is the founder and co-chair of the Congressional Creative Rights Caucus. She represents California's 27th Congressional District, including Pasadena and the West San Gabriel Valley, which has more API majority cities than any other district in the nation. And we're pleased that Representative Chu has agreed to co-sponsor all 8 bills of the People's Platform that was mentioned earlier. And she's one of only a handful of Congress members. She's one of only a handful of Congress members across the nation to do so, along with Barbara Lee, Ro Khanna, Dan Schakowsky, and Earl Blumenauer. She's also my representative in Congress, and I'm very pleased she's taking a stand on the side of people over profits and supporting the People's Platform, including Medicare for All. So let's give her a hand.
Well, thank you all. It's so great to be here, and it's so great to be with Dr. Paul Song. Thank you for sharing your wisdom with us. Yes, we are in a critical period in Congress, and we could change things with this election. And one of the things I would like to change is for support for Medicare for All. Now, how can we be a country that spends more on health care per person than any other country in the world, and yet rank the lowest out of the 10 most developed countries in terms of healthiness? Well, it's because of our bloated bureaucracy, the middlemen who primarily are there to stop monies from being spent on health care. And that is why one of the first things that I did when I was first elected to Congress in 2009 was to sponsor the single-payer bill. I was a single-payer bill co-sponsor in every subsequent Congress. Today, this bill is called the Expanded and Improved Medicare for All Act, H.R. 676, and I am still a co-sponsor of it. Of course, it would establish a publicly financed system of health care that would expand and improve on the already successful Medicare program. It would ensure that all medically necessary care is covered. It would give patients the freedom to have the care of participating physicians and institutions, and it would free Americans from staying in a job that they don't like just because of the health benefits that it offers. So we took an exciting step this summer when we founded the Medicare for All Congressional Caucus, and I am very proud to announce that we already have 73 members of Congress. That is a lot, so I think that we are already on the road to success. But this caucus is important because it will give Congress members the ability to provide for some strategy. It will be able to give us the kinds of expertise and briefings that we need to get information that will allow us to move the bar forward on Medicare for All. And we hope that with this kind of strategizing, we can indeed make Medicare for All a reality. Now, last year, I got into an even better position to work on this issue. I was promoted to be a member of the House Ways and Means Committee. This is considered one of the most powerful committees in the House of Representatives because it deals with all fiscal matters that pertain to our federal government. This committee is so sought after because it is one of the most powerful, but because of that, there were very few women and very few people of color. In fact, when I got appointed, I became the first Asian American woman in history ever to be on the committee. And the first thing that I did when I got on it was to ask to be appointed to the Health Subcommittee, where the decisions pertaining to Medicare for All will be made. One of the things that we have to do in this committee is to make sure that President Trump doesn't undermine the progress that we've made so far. The Affordable Care Act was an important step towards our goal of universal health care. Thanks to the ACA, the number of uninsured Americans was reduced by 20 million. For the first time, we made sure that Americans born with pre-existing conditions could not be denied health care coverage. Women could no longer be charged more coverage than men. And we expanded Medicaid to millions of Americans who couldn't otherwise afford health insurance. And for so many, this was the first time they were able to get any kind of health insurance. But right now, Republicans in Congress and the Trump administration are doing what they can to undermine the ACA and take even that amount that we have in our healthcare system right now. In fact, they've had nearly 70 bills on the floor to dismantle the ACA. I voted 70 times to defend what we have. And since their last attempts to repeal the bill failed last year, now they're trying to have a different tactic. Now they're trying to dismantle the ACA piece by piece. And they're trying to do it by President Trump's executive orders. They've slashed funding for the outreach and education program and the Navigator program by 90%. There's virtually nothing in there for outreach and education to get people to enroll in the marketplace. They have repealed the individual mandate in order to dismantle the system. But by doing that, they take out healthy people from the system, and then you'll end up with sicker persons in the program. That's not good for the overall ACA. And finally, they are refusing to defend the ACA in court, even though it is the law of the land. The ACA is one thing that we have to make sure at least is there for now, but there's so much more that we need to do. First, we have to lower the price of prescription drugs. How can Americans pay the highest prices for prescription drugs in the entire world? Last year, nearly 1 in 5 Americans did not get their prescription drugs filled because they did not have the money. And that is why we have to make sure that we take some great steps forward. One thing is to allow for Medicare to bargain for prescription drug prices, which is now not even allowed by law. The other thing is that we need to have transparency. We need to have drug companies justify their big price increases before the Secretary of Health and Human Services, before they can actually implement such a big price increase. And there is something that I want to address, since we are Asian Pacific Islanders, and that is the issue of health equity. When we have a Medicare for All, I want to make sure there are measures for health equity. How can Asian Pacific Islanders be 6% of the US population, but have 50% of the hepatitis B cases? That just shows you that we do have health disparities. And we in the Tri-Caucus have tried our best to address this. The Tri-Caucus is comprised of the Congressional Asian Pacific Caucus, which I chair, the Congressional Black Caucus, and the Congressional Hispanic Caucus. And we want to make sure that disparities are addressed. In the bill that we've put forth, the Health Equity and Accountability Act, we are addressing disparities all the way from diversity in the healthcare workforce to making sure that the research dollars go to diseases that predominantly impact people of color, like sickle cell anemia or hepatitis, to addressing the environmental factors that impact the health of minority children and families. And also, the Health Equity Act includes one of my bills, which is the Stop Mental Health Stigma in Our Communities Act, HR 2677, which would have a dedicated set of funding to address the mental health issues of the Asian Pacific Islander community. One of the issues that we face is that in discussing mental health needs, even with our own families, Asian Pacific Islanders feel a huge stigma, and they just don't. And so what this would do is provide resources towards addressing it. Well, I hope that we can work together in getting some progress on Medicare for All, but I have to tell you that in order to do that, we have to take the House back. We will make no progress. That means 23 seats in this nation. 7 of those targeted seats are right here in California. 5 of those seats are right here in Southern California. And right now, every single one of our Southern California seats are being held by a Republican whose district voted for Hillary Clinton. So we think that there's a chance for a great deal of change there. But not only that, in each of these seats, our candidates are running even or even running slightly ahead of the incumbent. So we feel we're in a pretty good spot to change things. But you know what? We have over 50 days to go. It's actually coming in pretty close. And we need to make sure that everybody who can vote does vote, so that we change the House, so that we can stop this madness that is occurring in the White House with this president. So thank you all very much.
Thank you so much. Thank you so much, Congressman Chu. Like she was saying, what is the cost now? Theraprem, AIDS medication, $700 a pop. $650 a pop, EpiPen. Remember that big scandal when they raised that, jacked up that cost? So essentially, you got the money, you're going to live. If you don't, you die. That's basically what it comes down to in our system here. 37th in the world. I think we're a little bit above Aruba, but below Costa Rica. Or I think it was the other way around maybe. But anyway, we're 37th. Okay, so got a lot of work to do on that end, but things sound very, very positive. Thank you so much for your work, Judy.